Fair 2021 project is painkillers. Our question is, what are the physiological and psychological effects of painkillers? Our hypothesis is that we assume that over-the-counter painkillers result in long-term damage if overuse or reliance on painkillers occurs. We predict that we will find that it has a severe effect on your neurological and nervous system when it comes to pain.
Background information. When you injure yourself, your body sends a signal through your nerve endings which leads to your brain. This causes your brain to react to the activity being done by giving you the pain that you have. One of the ways that painkillers relieve this pain is by interfering with and destroying that signal either in your nerves or at the site of pain. The second way that these drugs can stop your pain is by changing your brain's perspective and sensitivity to the pain. Your body usually produces natural hormones called neurotransmitters. The job of these hormones is to bind your opioid receptors in your body when you are feeling pain. When you ingest painkillers, they take the role of the neurotransmitters in dealing with the pain and binding the receptors. Your body then slows or stops the production of these hormones because their job is already being done by the painkillers. Since these drugs act like the neurotransmitters, they essentially trick your body into thinking that it already has produced enough of these hormones, so it doesn't produce any more. But this can cause your body to become less capable of healing naturally since there are less neurotransmitters. Another role of the neurotransmitters is to send signals through your nerves to your brain, which connects your brain to your body. Although painkillers do take on the job of the neurotransmitters in the sense that they bind your opioid receptors, which are causing you pain, they do not take on the role of sending signals to your brain. Since there is now little to no neurotransmitters left in your body because your body has stopped the production of these hormones due to the painkillers, this job is not getting completed. This can negatively depress your central nervous system, which can also result in slurred speech, slow breathing, or even slow bodily reactions.
The process of an oral drug, such as an ibuprofen tablet, going through your body is known as pharmacokinetics. The drug begins by making its way through your body to your stomach. It then dissolves in your stomach's acid. These dissolved pieces travel through your bloodstream until they find your liver. Your liver contains enzymes. These enzymes attempt to neutralize the drug and change it into metabolites. They try and neutralize the drug because they see it as a foreign substance. These metabolites then remain in your bloodstream for 24 hours or even up to a week. It all depends on your metabolism speed. Basically, metabolites are tiny versions of the drug. They do the same thing but are just in a much smaller way, and they travel in much smaller groups than the actual drug itself. But the pieces of the drug that do make it through your body will continue through your bloodstream until they find an area in which cells are releasing a chemical called prostaglandins. Prostaglandins are released from a cell when there's an emergency, such as a wound or something is in pain. Once they have found the prostaglandin released, they will try and cover it with their own chemical, whatever that drug may be.
Acetaminophen, also known as Tylenol, is an over-the-counter drug found in pharmacies. It is used in over 600 prescribed drugs, but can also be unprescribed and purchased at a local pharmacy. Acetaminophen toxicity occurs in a patient who has overdosed on this specific drug. This kind of toxicity is very dangerous and may cause liver destruction or even death. Tylenol is suggested to take 2 pills at a time. 1 pill is 500 milligrams. An important warning on the packaging is not to take more than 8 pills over the span of 24 hours. Acetaminophen in long-term use can result in some of the side effects including stomach problems, kidney problems, high blood pressure, fluid retention, and other allergic reactions. According to various sources, acetaminophen is the only active ingredient in this pill. It can cause issues such as heart attacks and internal bleeding when taken in large amounts. In the worst case, overdosing on acetaminophen can also cause extreme liver failure or it can be fatal. Ibuprofen is also known as the brand Advil. Advil is an over-the-counter drug found on pharmacy shelves, making it for easy access. The recommended dose for ibuprofen for adults is 1,200 milligrams per day or 6 tablets a day. The most important drug in ibuprofen is propionic acid. Propionic acid has side effects such as headaches, nausea, vomiting, diarrhea, and abdominal pain.
Propionic acid of an ibuprofen tablet, we first found the propionic acid's gram per molar mass, which is 74.08. Then we used a 200 gram ibuprofen tablet and found that there are 10 substances, active and inactive, in an ibuprofen tablet. Taking the 74.08 grams per molar, we divided that by the 10 substances, which gave us 7.408. Taking the 7.408, we divided that by the 200 grams in the ibuprofen tablet, which gave us 0.0371. Multiplying that by 100 gave us 3.704. And that concluded that in a 200 gram ibuprofen tablet, there are 3.704 grams of propionic acid.
Dextromethorphan, also known as cough syrup, is an easy-access over-the-counter drug. Dextromethorphan is not to be used if a cough is occurring due to smoking, asthma, or emphysema, and only due to illnesses such as the flu. The active chemical in dextromethorphan is Robitussin. Robitussin can cause side effects such as drowsiness, dizziness, lightheadedness, headache, facial flushing, nausea, vomiting, or upset stomach. All of these side effects are the result of taking more than the suggested amount of 30 milligrams every 6 to 8 hours.
Amount of Robitussin in a dextromethorphan bottle, we first found Robitussin's gram per molar mass, which is 198.22. We then used a 118 milliliter dextromethorphan bottle to find that there are 2 substances that make up dextromethorphan. Taking the 198.22 grams per molar, we divided that by the 2 substances in the dextromethorphan bottle, which gave us 99.11. 99.11 divided by the 118 dextromethorphan bottle gave us 0.399. Multiplying that by 100, we got 84. That concluded that there are 84 milliliters of Robitussin in a 118 milliliter dextromethorphan bottle.
Naproxen, also known as Aleve, is an over-the-counter drug found in pharmacies and drugstores around the globe. Naproxen is used to reduce inflammation in diseases such as pain, menstrual cramps, inflammatory diseases such as rheumatoid arthritis, and fever. The active chemical in naproxen is known as aryolactic acid. This chemical itself is known to cause major issues involving gastrointestinal ulcers and bleeds, heart attacks, or even kidney diseases. These may result from an overdose on the drug and incorrect intake of the drugs. Adults, ages 12 to 65, are advised to take 1 tablet every 8 to 12 hours. The packaging warns users not to supply Aleve to children under the age of 12 because it affects their growth and development. It is also advised to take medication with a full glass of water and consistently stay hydrated throughout the day.
To find how much aryolactic acid is in a naproxen pill, we began by finding aryolactic acid's gram per molar mass. But aryolactic acid is not calculated in grams per molar masses, it's calculated in kDAs. 1 kDa is equivalent to 1 gram per molar mass, so we're going to continue with our usual math. So aryolactic acid has 25 kDAs, and using a 0.25 gram naproxen pill, found there's about 5 substances that make up the naproxen pill. So taking the 12 kDa and dividing them by the 5 substances, we get 5 kDAs. Those 5 kDAs divided by the 0.25 gram naproxen pill gave us 20. Multiplying 20 by 100, we get 200 milligrams of aryolactic acid and a 250 milligram naproxen pill.
Painkillers and drugs were originally used to kill large bacteria that couldn't be erased naturally. These drugs were made out of everyday natural products such as tree bark or well-nurtured soil. As these pain-killing drugs became more profound and more popular, society began creating drugs for issues the body could already usually solve naturally. Some of these drugs had unknown effects and had addictive qualities, so these were categorized as illegal. But as research in these illegal drugs developed, we began learning of their side effects and legalizing them for medical purposes only. However, humanity soon began to crave these drugs because they were known to heal diseases faster than ever, and some individuals who weren't in need of them to relieve their diseases got their hands on them and began an epidemic involving dangerous diseases. Today, society's patience for the natural healing process has completely fallen. We are way more reliable on drugs to soothe our issues, but what are these drugs actually doing in your body?
Preventing an overdose on over-the-counter painkillers involves being aware of its effects and the procedures when using the drug. When taking simple painkillers, ones that are not prescribed and over-the-counter, it's still important to ask your doctor questions. So we create an acronym to help remember what you need to do every single time you're taking a new painkiller. It is known as Duramacu. G stands for ask yourself what's your gender, what kind of hormones are in your body. I stands for intake. How is the painkiller going into your body? R stands for research. Remember to do your research and understand how the painkiller is going to affect your body. A stands for amount. How much are you taking at a time and what is the limit? M stands for metabolism. Understand your metabolism and how long those metabolites are going to stay in your body. A stands for age. What is your age and what is the limit based on your age? And Q stands for questions. What kind of questions do you need to ask your doctor to better understand the painkiller itself?
If we were to continue our research, we would like to look deeper into how painkillers slow down your reaction time. In our previous studies, we did touch on this topic, but we would like a more extensive understanding of it. It would also be important to analyze how one-time uses of the drug will affect our study. We have examined many over-the-counter drugs, but feel it would also be relevant to compare narcotic drugs as well. In doing this, we can attempt to discover which drug is the healthiest and best at pain relieving. We can also look further into the opioid receptors and other hormones that are affected by the consumption of painkillers.
In conclusion, we found that the intake of over-the-counter drugs will in fact harm your long-term health. From our research, we found that as you become more used to taking pain-soothing drugs, your body's reaction time will slow down. We also saw that there are some drugs that have less dangerous effects than others, and the chemicals within them all vary, based on how many substances they have, and based on whether those substances are active or inactive. Overall, the intake of pain-killing drugs is extremely risky if you are unaware of the long-term consequences. And even when dealing with over-the-counter, unprescribed drugs, it's important to read the labels and understand what your metabolism is, and your age, and how those drugs are affecting you.